Hi everyone, I'm Dr. Sanjiv Rampal. So today we'll be talking again another topic on the common osteoarthritis or aging of the knee, right? So as we all know, osteoarthritis is a very common public health problem in our shores in Malaysia. So today I'll be talking to you about one of the more common causes of knee pain, that is osteoarthritis. So as we all know, the common knee pain in the elderly, especially above the age of 65, is the most common complaint when it comes to dealing with knee pain in the elderly. So knee osteoarthritis is just a fancy name to say that there is exaggerated or worsening of aging process over the knee. So I have here a knee model, and we'll be going through the normal common treatments that we do here in Malaysia. So in Malaysia, one of the main treatments in osteoarthritis, or not one of the most main, but it's also one of the most commonly used, is in the joint or intra-articular injections of the knee. So what we do is we usually take a gel or some form of medicine, and we inject it directly into the knee. This is a sample of a knee model over here. So what are the common types of intra-articular knee injections? Usually when you go see a doctor, they will probably evaluate the knee, and what is the more common causes, or what are the common symptoms of knee pain or knee osteoarthritis? Is usually pain, a nagging, a niggling kind of pain, knee stiffness, and also mild swelling. So usually the pain comes when you're walking up the stairs, or kneeling, or when you sembahyang, or you praying time when you have to kneel. Yeah. So one of the treatments of knee osteoarthritis is intra-articular injection of the knee. So what is it? So what are the common questions? What are the four types of the common types of knee injections? Are usually number one, corticosteroids. Knee injections. This are generally constituents that usually is 1 or 2 millimeters, 1 or 2 cc's, something like this, and we inject it directly into the knee. This reduces inflammation, is relatively safe in patients who do not have premorbid or other medical problems, major medical problems. The second most common type of knee injections are intra-articular hyaluronic acid injections, things like gels like this, that's in my hand, or smaller gel injections like this. This is about 2 to 3 cc's. It measures sometimes 6 cc's or 6 mLs, and we inject it directly into the knee. So most of my patients usually ask me, what is hyaluronic acid injection? So basically, hyaluronic acid is a substituent or normal substituent of a normal knee that we have, and it mimics the gel that lubricates the knee. So we inject these knees with extra or exogenous material like gel. This helps with slowing down the process of aging. So what is the third most commonly injected knee injection is PRP, or plasma-rich platelets. So basically what happens there is we take patient's blood, about 3 to 5 cc's of blood, and we spin it around close to 3 to 4,000 to 5,000 spins per minute for around 5 minutes, and we get the good part of the healing aspect of the knee, of the blood, and the blood plasma is basically the part of the blood that doesn't have these red blood cells, and these are the healing aspects of the blood, and we inject that directly into your knee. And the last one, which is relatively uncommon and expensive, which is still in research process, is called stem cell injections. So stem cell injections is basically, usually there's 2 types. One's that we draw blood from the patient, and another one is that is taken from donor cells. So what we do is we take the healing part of the blood, and we use stem cell technology, and we inject it into the knee. Well, so now we will be talking about a little bit about how to prepare for this, because my patients usually ask me in the local shores in Malaysia, but some of the common questions we are going to go through about what exactly, how we can help these patients who are going to have this procedure to be done. So usually the first questions they ask is, generally, what is this gel injection that you be put into the knee, and is it harmful? So basically this is a common question that's been asked in my practice. So what is this gel? As I said, the gels are usually among the 4 types, and it's usually clearless gel that some form constitutes part of the normal fluid of the body. And there's 4 main kinds. One is corticosteroids, another one is hyaluronic acid injection or hyaluronic gel injection. Third one is plasma-rich platelet injection, PRP, and the last one is stem cell. There are other kinds that is less popular, which we do not really give that frequently in leisure. Alright, so that's 4. Is it harmful? No, it's not harmful. Usually it can be safely given with minimal side effects, but please do consult your local physician or your orthopedic surgeon before doing any of these injections. Okay, the next question is, how painful is it? And can I go home, doctor? Or can I drive the car after getting myself injected? And do we have to stay over in the hospital for this injection? So the answer is no. We usually do not need. It's usually done as outpatient basis in Malaysian shores or Malaysian healthcare system. So we usually give the injection. The whole procedure takes less than 3 minutes to be given, and it's relatively safe, and it's given in a sterile technique or a sterile environment. Usually be given in either in the clinic basis or in the operation theatre. Yep. So can I drive after that? I usually tell my patients not to overexert themselves over the knee for the next 2 days, and after that they're basically back to normal. So patients will be walking right after. I usually put an ice pack on after injecting my patients. So that will be the preparation after that. So the next question is, how long do I keep the plaster over my knee? So basically there's a small plaster being applied, usually water resistant. You usually can keep it dry for the next 2 days, right? And you have to keep it dry. What are the techniques that I usually tell my patients? Some of my patients regularly, they put a cling wrap or a plastic wrap, the food wrapper around their knee, and they have a shower. So basically you just take 2 days. You're able to walk after the injection. It takes less than 2 minutes. Usually the constituents of the injection is less than 5 cc's. Okay, now a common type of injection is called corticosteroids or steroid injections right into the knee. So my patients usually ask me, how often can you give it and is it safe? So basically corticosteroids are strong anti-inflammatory agents. They are commonly given in general practice by general physicians and also orthopedic surgeons. It safely can be given. Its amount 1 cc to 2 cc's in amount. Usually be given in sterile environment. So the question is, how common can it be given in the lifetime? So usually these are strong anti-inflammatory agents that's given straight into the knee. Usually has minimal effect over the whole body, but it will depend on the stage of osteoarthritis that you have. So you have to consult your orthopedic surgeon. So a person who has an advanced stage of arthritis will probably have the injection done, but the effectivity is not as great as a person who's a younger age group who comes with intermittent pain. So those patients will probably have it. So how often can you be given? It depends on the stage, and we generally don't give more than 3 in the whole lifetime into each knee. Yeah. The last question is, which of these types of injections are the best injections, or which is cost effective? So according to the evidence that we have and the current practice, there's no one specific injection that is best, but I would suggest the best, most cost effective would be the basic corticosteroids. Hyaluronic acid and PRP is basically newer versions of this treatment, and it has some evidence to say that it does reduce the pain relief in short duration of time, meaning 2 weeks to 6 weeks. Right, and there is current evolving research and evolving evidence that it has some role in reducing or not reversing, but reducing the advancing of the disease. Yeah, so I think that is all for today. Again, for my patients who are going to undergo the treatment, I suggest it's a very outpatient and a very short procedure, and you can follow me in all the social media outlets. Thank you so much. Bye bye.